Welcome to our ACPS Reopening Staff Chat. Thank you for making time to join us this afternoon. My name is Helen Lloyd. I'm the Executive Director of Communications. This session is being streamed live on Facebook and will be posted to the ACPS at Home website in the next few days. So let me start by introducing my co-moderators for today, and a big thank you to Sue Horita, who is a Teacher Advisory Council Chairperson, and Dawn Lucas, who is our representative from the Education Association of Alexandria. Thank you both for helping to facilitate this chat and for supporting our panel of ACPS staff today. We really appreciate it. Today, we also have the honor of having Superintendent of Schools, Dr. Gregory C. Hutchins Jr. as a moderator. So Dr. Hutchins, welcome. Thank you for joining us in this role today to help answer questions from our staff and to listen to feedback on some of our key topics. If you'd like to say a few words, maybe a welcome introduction.
Thank you, Ms. Lloyd. And yes, I would like to welcome all of our staff. One, I know that these are unprecedented times. I keep saying it over and over again. I know you all are experiencing the same things that we're experiencing here in our own household. And I just want to thank you all, one, for your patience, your grace, and I'm also just asking for some flexibility during this time, because what you're going to learn today and what we're going to be able to discuss with you is where we are right now. And as you all know, this is like an ever-changing situation. Every week there seems like there's new information that we receive or new data that's being put out into the community or across the country that we have to adhere to or make some adjustments with. So I just want to welcome you all. And I'm going to say this final thing before I turn things back over to Ms. Lloyd. I've been saying it time and time again that self-care is so important for all of us. The only way we're going to be able to get through this pandemic is by making sure we're taking care of ourselves first. You are nothing for anybody else if you have nothing left to give, right? So it's whatever you do to do self-care, whether it's running or, walking or hanging out or talking to people, just having complete silence or whatever you choose to do. I truly, truly recommend that you all continue to practice self-care during this time, because we're going to be so much better together than alone. And we can't make it unless everybody is at 100%. So thank you and welcome.
So thank you, Dr. Hutchins, for those wise words. And we know that you've been practicing a little bit of self-care, because we quite often get tweets or social media of people who've seen you running around Old Town. So first, let me introduce our panel of staff representatives today. We want to say thank you for taking the time to solicit questions from other staff members and to sit on this panel and give your thoughts, input, and feedback today. So as I read your name out, I just want to give a quick wave so people can see who you are. Joyce Braxton, Stephanie Kessinger, David Paladin Fernandez, Lamore Fritz, Raina O'Connor, June Dade, Suzanne Lang, Gamar Hines, Stephanie Johnson, Tracy Robertson, Willie Antrim Jr., Kelly Cheeks, Lisa Pastor, and Althea Huggins. So thank you all. Our goal today is to hear in greater depth about the particular issues that you as staff may face in the fall, and to begin working through some of the potential solutions for them. So with that in mind, I want to introduce our staff panelists, who are all members of the cross-functional planning teams who've been working tirelessly to plan the best ways to reopen our schools in the fall. So, I'm going to run through your names again. If you could give a quick wave or acknowledgement. Dr. Stephen Wilkins, our Chief of Staff. Dr. Terry Mazingo, a Chief of Teaching, Learning and Leadership. Dr. Elizabeth Hoover, our Chief Technology Officer. Dr. Bethany Nickerson, our Executive Director of English Learner Services. Terry Werner, I know she's about to step on this call if she's not here already, Executive Director of Specialized Instruction. Erica Gulick, Director of Planning, of Capital Programs, Planning and Design. Sorry, Erica, your title is always confusing. And then also Daryl Sampson, Executive Director of Student Support Teams. Kenitra Wood, Executive Director of Equity and Alternative Programs, and Marcia Jackson, Executive Director of Student Services. have I missed anyone? I have missed you, Mr. Page. So Clinton Page, our Director of Accountability and Research. Sorry, our Chief of Accountability and Research. And I understand that Dr. Julie Crawford may also be joining us shortly as well. So recently we asked you to submit your questions around reopening, and our ACPS staff experts here with us today will hopefully be answering some of your questions. Today, during this chat, we will also be giving you the opportunity to ask live questions in the Q&A box. And as time permits, we'll get to some of those live questions, hopefully before the end of today. So any questions that we don't get to today will be answered on the FAQ and the reopening page of the ACPS at Home website. And we will also share links to those in ACPS Insider. So please feel free to go back. Don't feel like you've been missed out today because your question wasn't answered directly verbally in this chat. Every question will be answered. Please, we want to reassure you of that. So today's session will be divided into key areas. The topics will be health and safety, the delivery of instruction, logistics such as transportation and movement around schools, and other important staff needs such as potentially childcare. Please, again, as I said, feel free to post your questions on these topics in the Q&A box as each topic is addressed, and we will get to those questions that are relevant on that topic. So I also want to thank each of you who completed the reopening survey. The reopening survey showed us that 40% of our parents preferred a fully virtual model, 60% preferred a hybrid model with a mix of virtual and in-school learning, and 63% of our staff said they were likely or somewhat likely to return if ACPS were able to offer a hybrid model in the fall. So ACPS has not yet determined, of course, which model or which combination of models it will be able to follow in the fall. We're obviously still working through that. The final plan we presented to the school board on August the 7th, and details of what that means for staff, students, and their families will be shared with the community by August the 14th. So without further ado, I want to move straight to our first topic today, which is, most importantly, potentially, health and safety. Please feel free again to put your questions in the Q&A box, and those questions should be around health and safety. So the survey data told us that health and safety is the top priority for our staff when it comes to reopening our schools. And we've received many, many questions around health and safety and potentially the models that we're considering to reopen our schools in the fall. So let's start there. And Dr. Touchins, I'm going to turn this over to you. So perhaps you could help us out with the first question and talk perhaps a little bit about why we are unable to offer a traditional model this fall.
So thank you for the question. So one in particular is the health and safety of our staff and our students. Right now, in order for us to adhere to the Center for Disease Control or the CDC guidelines, it is impossible for us to have everybody in the school all at once every single day. So that is why, as a committee, our cross-functional team committee, our planning team has looked at the fact that it really is just not feasible to do a traditional opening with the CDC guidelines. And as long as they are present, as they are right now, which is 6 feet distancing, face coverings and things of that nature, we are just not in a situation where we could have a traditional opening and everyone at school at once.
Thank you. Yeah, very, very valid point. And so has ACPS actually considered giving staff the choice then of either returning 100% virtually or 100% in person?
So yeah, with our initial survey, we were asking staff, who was likely to come back. That was kind of like the beginning phase. We are going to be polling our staff again, just to find out, especially once you have more information around what our option looks like. I mean, right now we're looking at the hybrid model, and we're also looking at the 100% virtual. There are going to be staff expectations with both of those models. And it's going to be important that when we ask definitively as a staff member, are you going to come back, and if we do 100% virtual, are you going to come back if we do a hybrid approach, which we're going to be polling you all, I believe, the week of August the 3rd, that Monday or so. So that will be an opportunity for staff to really chime in on what their final or definitive decision at that moment is. And as you know, when we looked at the survey data just a few weeks ago, in just the past 2 weeks, you know, comments have shifted from, you know, I know it was 60% who wanted hybrid, but now we're receiving a lot more emails in regards to doing 100% virtual in just 2 weeks. So, you know, things change over time, and it's going to be very important for us to look at multiple data points along the way.
Yeah, and the model selected for the fall, I know, will depend on what is practical and what is feasible and what we're actually able to deliver in terms of our services that our students may need. And I know
Exactly.
it may also not look the same for every student group. Is that right? But equity obviously
That is right. You know, I think we have to shift from how it was in the spring. In the spring, we were really trying to have equal access to everybody, meaning we wanted all teachers to have the same expectations and all staff to have the same expectations depending on their employment group. We wanted all students to have access to the internet and all students to have technology devices. And that was more equal access approach. Now, as we are going into the fall with, you know, virtual learning and asynchronous and synchronous learning, we're going to have to really meet our students, our staff, and our families where they are and not assume that everybody's at the same place, right? So some students might need additional supports. Some teachers might need additional supports depending on their circumstance, because when you're now at home trying to deliver some type of instruction, there are some barriers for each person. And we're going to just have to not be so equal. We're going to have to now be more equitable and provide the additional supports when needed. So one student's experience in regards to their support might be different than another student's, but we are going to have some concrete expectations for staff too, and that's something we'll be able to talk about later on.
So we've got a couple of questions that's come in already around policies and HR policies around high risk staff population potentially. So I don't know if you want to take this, Dr. Hutchins. I know we have Dr. Wilkins also on the call. He may want to weigh in on the answers to these questions. So will teachers and staff who are considered high risk by the CDC be compelled to go into work if we decide on a hybrid?
Well, you know, I think that the term compelled to go to work, it's kind of like I'm kind of nervous about that term, you know, because now the CDC, well, not the CDC, but the government is looking at more flexibility with our FMLA policies due to the whole COVID-19 pandemic. And we have to put all that into consideration as well. I think that, you know, everybody's situation might be different and everybody's circumstance might be different. So it's going to be very important that we are working, or that any staff member is working directly with our human resources department for their particular situation, so that we are understanding, you know, their circumstance and making sure that we're providing them with their rights, as well as some of the new laws that have just come about that are new to all of us that we're learning about. So it really is it's going to vary depending on the circumstance and the situation, but there's a lot more flexibility now in regards to leave for staff members, not just in ACPS, but across the country due to the global pandemic in FMLA. Dr. Wilkins, I don't know if there's anything that I have left out from that you want to add.
Thank you, Dr. Hutchins, and good afternoon to everyone. I would only add that it's really imperative that all employees stay in good contact with their healthcare provider and seek that guidance with respect to your personal health. The first and foremost thing that we want is to make sure that everyone is safe and healthy. So please be ready to contact your healthcare provider should you exhibit any symptoms with respect to COVID. With that said, the CDC guidance is very broad, and you do need that expertise to better understand your condition and also to work with human resources. So for example, there's a difference among symptoms. There's a range. There's mild symptoms, there are moderate symptoms, and there are also critical and severe symptoms. So all of this has to be worked out on an individual basis with the respective healthcare provider. And again, we would encourage you all to do that. Certainly, if you feel like you are sick, you should not come to work. But if you come to work and feel that you are becoming sick, we want you to immediately stop what you're doing and report it, and then we will guide you from there. Thank you.
And there are specific, as we're going into the next question, there are specific protocols that the VDOE has shared with all school divisions that we're still working through. So we want to be able to, with whichever model we choose or whichever model we recommend to the school board, that we have this information along with that plan. So for example, if there's a specific protocol that we're going to use for staff members who may be sick or students who may be sick, that we're showing you specifically how we plan to handle that situation, because the health and safety of our staff and our students, I mean, it has to be the number one priority, hands down, in regards to everything else. And it was pretty evident in the surveys on both the staff survey as well as our family survey that health and safety was the top priority. First, health and safety of you as an individual, and then the health and safety of your family, because whatever you have, you take home to whoever's in your home. And everybody has very different situations where you may have somebody, you might not have, a compromised immune system, but someone in your household might have one. And you don't want to bring any type of danger to your families at home. So those are some serious situations we have to keep into perspective with either choice that we make.
And am I right as well, Dr. Wilkins? So an employee who's directed by medical authority to quarantine may qualify for leave benefits under the Families First Coronavirus Response Act, Employer Paid Leave Requirements, FFCRA. And that honestly, they should probably go straight to HR if they have questions around this or assistance. Is that correct?
Yes, that's correct. But again, just to emphasize that qualification for paid sick leave under FFCRA does require a diagnosis by a healthcare provider. Thank you.
Making sure that there's some communication. Yeah, I think in what Dr. Wilkins is saying is just making sure that we have communication with our health professionals too, so that you're just not self-diagnosing yourselves, and which I don't think anybody would want to do in this state of mind at this point. But sometimes everybody gets nervous. I had a cough the other day. I was nervous. It was allergies. But I think that it's important for us to make sure that we're seeing our health professionals and that we're getting the appropriate documentation so that we can have access to all of these additional kind of rights and opportunities that now afford us due to this whole global pandemic.
Thank you very much, both of you. So I'm going to change track a little bit here. We have a question around potentially a model, but also working with our high-risk students and high-risk staff members. So maybe Dr. Mozingo might want to weigh in on this one. So could vulnerable children be paired with vulnerable teachers and lower risk students paired with lower risk and or less concerned teachers, effectively creating two tiers of learning maybe within the same school so that each student is getting an education, getting what they need, but also staff needs are met as well. Dr. Mozingo, do you want to weigh in on that, or Dr. Corker?
Yes. So I'll start. Thank you so much and good afternoon, everyone. I want to start first with the focus on health and safety. That is certainly the priority, as has already been indicated. And the teams are in the process of developing and obviously proposing some scheduling options. And at the heart of those options will be this issue, particularly around even instructional equity. This also means that as they are looking at and developing and proposing schedules, at the heart of those schedules, we will make sure that we are proposing schedules that address the needs of students as well as our staff that might have particular needs. We are also exploring a combination of schedules, but again, at the heart of those schedules will be this notion of focusing and addressing the specific needs of staff and students. And we hope to, our goal is to propose those schedules again on August the 7th.
Helen, I think you're on mute.
Yes. Thank you very much, Dr. Mozingo. So I wonder if any of our guest staff panelists have a view on this. I want to open it up to our staff representatives and see if they can share some ideas that they may have on this.
Sorry, I don't know if I have so much an idea, but I think some things that a lot of people that have reached out to me are very concerned about. And personally, my husband got tested for COVID and it took him 11 days to get his results. So a lot of teachers are concerned, you know, if I stay home for 11 days to make sure I'm safe, but then it turns out I was negative, you know, am I going to be losing my sick leave? And so a lot of teachers are you know, for that discussion is what happens, you know, if I, where does that time come from? And so just something that I've been hearing a lot about.
Thank you very much.
You know, that's a good question that a lot of school divisions are really grappling with right now. I was on a call recently with the state superintendent. We meet every week, and these are some of the same questions that come up from our state superintendent and other superintendents across the Commonwealth. And one thing that we have gotten some guidance on is if someone happens to have to be self-quarantined, right, but they're not experiencing any symptoms. So for example, you're at home, you don't have any symptoms, but you were tested, you're waiting for the results, you could still potentially do some virtual learning or instruction. So you could potentially still work, you know, similar to what we're all doing right now, so that you wouldn't have to use leave at all in a case like that. But it really is going to depend on which model we choose, whether it's going to be the hybrid approach or the 100% virtual approach. But I think that this March through June timeframe has opened the doors for so many, you know, creative ways of delivering instruction and for us doing public education now that, you know, I mean, there's so many possibilities that you may not even have to use to leave, but these are, we have an HR group that's specifically working on questions such as this one.
Thank you, Dr. Hutchins. Does anyone else have anything they would like to add to that from our panel?
Hi, I do. What about those that get the drive-up testings? Because I noticed you guys focused on going to your healthcare provider. What if someone didn't do that, but utilized one of the, sorry, my screen, my video keeps going out on its own. If someone decides to utilize, like ACPS was doing testing for a time, would that be the equivalent of seeing your doctor? Thank you.
So yes, right now, all of our testing, and Dr. Crawford, she can add to this, but all of our testing are administered by health professionals. So whether it is a drive up, now, unless you're doing a drive up in somebody's neighborhood who has some, you know, tests that we don't know about, but I believe for the most part, but Dr. Crawford, if you can just reiterate this, I believe that all COVID testing right now is based out of our health professionals and administered by a health professional.
Yes, you are correct. And so your drive-up testing would still get you a test result. I think what Dr. Wilkins was referring to is if you were symptomatic, whether it's mild or moderate, we would want to make sure that you were seeking to get medical advice from your medical provider. And regardless of who that is, if you feel you've had exposure, going to a drive-up is the same thing as going to your private provider. Obviously there's some differences in if a doctor's note is required, if an appointment is needed, and sometimes length of time, but there's not a distinction between the drive-up testing and getting one at your doctor's office.
Thank you. Is there anyone else who has any other input or, yes?
Yes, I'd like to add some feedback. Temperature checks have been proven only partly effective. In fact, the pulse oxygen and sense of smell tests have been used in other countries. What happens if a student or staff member is asymptomatic? Has ACPS discussed additional screening measures with the health department?
Very good question. We're just about to get to a series of questions actually on positive cases, which might be asymptomatic. So we just want to press pause on that one, and then we can address those with Dr. Crawford in a few minutes.
You're on mute again,
Yeah,
Helen,
I'm
I'm
move
sorry.
on, sorry. With some questions, it's always tricky, always tricky. Some questions around, it's like that multitasking, isn't it? Right brain, left brain. I don't know whether I can manage that these days. So we've got some questions around what happens when a staff member or a student test positive for COVID-19. And Dr. Crawford, I know this is your lane, so maybe you'd like to take that question.
It's mine, as well as our participants who are on this group working with our health and wellness. I know Dr. Harden, many of our staff members, Dr. Jackson, and our school nurses who are on could also contribute. But if we did have a staff member who was positive, and we have encountered this, you know, since our closure, so we do have experience in how to handle this situation. Obviously, if the person is symptomatic, or if they've gone through a temperature check that we have utilized over the summer and have a temperature, we encourage them to get medical assistance. We then, however, work directly with the health department. So when there's a suspected case, we contact the health department directly. If we had a situation where a teacher or a student was symptomatic at school, there's some very specific steps that we would follow on site to make sure that the student was removed to what people are referring to as an isolation room for monitoring, so that they could wait there and limit exposure before a parent or guardian was able to come and pick them up. If it was a staff member, they would be asked to go home immediately. Again, seek medical guidance. And just lost my train of thought. Then the next step, of course, is similar to what the health department does. It's our contact tracing. So we would identify for that student and that staff member, who have they had close contact with? That's closer than the 6 feet. That's more than 15 minutes without PPE. But really, from a school perspective, we would want to see who did this person interact with, and then determine if there was potential exposure. We do that in consultation with the health department. Of course, we have our school health staff in the building who are resources for us, but those would be some of the steps that we would take. We know that, as I said, we would utilize the isolation room. I know that school health staff has been having conversations among themselves and also with the state on this. We would want to make sure to have all of our preventative measures in place, like Dr. Hutchings started with, the 6 feet, use of PPE, trying to limit small gatherings. And the importance of that is, if we did have a positive case and we know we've had a small group together, that then limits exposure and also cuts down on some of the contact tracing that we need to do.
And I was just going to add, in addition to what Dr. Crawford said, and you just mentioned it about the PPE and the 6 feet social distancing. I think that for asymptomatic, individuals, and this was to Ms. Simmons' question, that having that PPE and making sure that we're following those 6 feet social distancing will help, hopefully prevent some of that contamination. And these are things that we have to put into consideration when we're talking about an in-person any model, whether it's a hybrid model, or if we were going back to school at some point, whenever that occurs. But those are factors that we are going to have to really talk through in ensuring that we're going to be able to have the appropriate PPE, because everybody can't afford face coverings, right? So, if we're saying that you're going to have them in schools, we're going to have to be able to provide them for people. And some people, which I've only heard this 2 times, and it wasn't in the school division. I was in a store recently and I was looking at the lady saying, "Where's your face covering?" Right? And she had mentioned to me that she can't wear face coverings because of she had something wrong with her breathing and her nose, that when her mouth is covered, she can't breathe and she will pass out. So we're going to need to start thinking about people who can't wear the face coverings. What are going to be some alternative measures that we're taking, whether it's the face shields that are in place now that you're able to have, or having them isolated in a certain area. I mean, there are a number of things that we really are going to have to just concretely work through. But these are the discussions that are happening right now as we're developing whichever option is most feasible for opening school.
Yes, so thank you, Dr. Hutchins. I think it's very important to hear that if people don't have access to PPE on their own, that we would be able to provide that PPE for them potentially. Okay, so moving on. So Dr. Crawford, you might want to stay kind of unmuted for this one, because I think this is also for you. So how many positive tests does it take, or does a school need, before it actually has to shut down?
Thank you. That's a hot question, obviously. And I don't mean to go back to the same answer here, but it's working with the health department. So it depends on the amount of exposure. It depends on many aspects. Where has the student been in the building? If it's been very limited, let's say we're in the hybrid model and we have a student or a staff member who is positive, but we know that they've had very limited exposure with people through our contact tracing and those people have not had great exposure, we would get guidance for the health department on would we need to close either a school or look at spread. If we had a person who was at multiple schools, then we would have a bigger impact. Really, the short answer is we would get guidance from the health department. We would begin our immediate steps of identifying the risk and exposure that the person has had, and then we would look at what shutdowns were necessary. Again, it depends on where the exposure took place and how many people someone was in contact with. Let me give a specific example. If we had a staff member who was on site, did not have interaction with a person, let's say they were there on a planning day, and were in their room, did not come within 6 feet of a person for more than 15 minutes without PPE, in some cases didn't pass anyone at all, and that person was positive. That's a different discussion on do we need to close the school if we contact trace there than if they have had exposure. In that case, we know we kick into what do we need to do for cleaning and disinfecting and protecting our custodians who would need to go into that room. We would look at closing off that part of the school or a room until that was done. But there really are so many variables that go into it that it's hard to give one specific measure of when we would close and when we wouldn't close.
Yeah, thank you, Dr. Crawford. And I know the VDOE guidance states that some sections of a school might be closed instead of the entire school, depending on the spread of the virus. So that's great to hear you confirm that. So quick questions around communications. We've had a lot about, how will you communicate a positive case? And the answer is, honestly, again, we will follow VDOE guidance. They lay it out already very, very clearly that letters are sent home to the entire school community outlining both the situation and explaining the actions that the school will be taking. The idea is to be as transparent as possible. However, the one caveat is that we will never name or identify the individual who has tested positive, and we protect their confidentiality at all times. So that's just kind of a thought there as well. So I think
Ms. Lloyd, I just wanted to reiterate what you just said in regards to the confidentiality piece, because a lot of times when there is a case in the school, it's rumored out, sometimes a family has not given us permission to disclose that information. Mm-hmm. So we're unable to validate that, yes, that's true. We'll say a staff member will, people who might have been in the, presence of us, that particular staff member, they might be called from a contact tracing list, and they might be, contacted to be told to quarantine or whatever, depending on the circumstance. But we as a school division cannot disclose that kind of information. And I think that is just really, really important for us. I mean, we all have rights in regards to our medical rights. And just because it's a global pandemic doesn't mean we no longer have rights. So we have to make sure that we are respecting people's confidentiality and their privacy. And when we're not releasing names, it is most likely because a family is not giving us permission to release their names, because a lot of things come with that too. People might then say, I'm never going to be around you, or, there are a number of factors that can happen for why people don't want to release their information, their names. But we're going to follow whatever the guidelines that are given to us from the health department as well as the CDC to ensure the safety of others once we've identified someone who has contracted COVID-19.
Yes, absolutely. And thank you for reiterating that, Dr. Hutchins. It's a very, very important point that we always protect the privacy of our students and our staff members too. So moving on to kind of some questions around testing. So how often will teachers and staff be tested if we do return to school? This might be one for you, Dr. Hutchins, or one for Dr. Crawford, potentially.
Well, I know at this time, and Dr. Crawford, you can elaborate on this, but I know at this time, the CDC or the VDOE has not required us to test all of our staff or even our students. So that is not something that is an expectation in regards to our guidance. Dr. Crawford, would you like to elaborate on that?
Yeah, that's correct. That it's not been a recommendation that has come out of the CDC for school-wide testing. What we do in the examples that we've already talked about is that if someone is symptomatic, hopefully, our guidance would certainly be to staff members and to parents to seek medical input and see if testing is required. If there had been potential exposure through a positive case, then that person would go either to neighborhood health or work with us, the health department, a private provider, to pursue testing. But there's not, it is not within the recommendation at this time for the school system to set up explicit testing. We have, while we're lucky to have our registered nurses on site, we do not have a full medical team who could assist with that process, which is why we really do need to defer that to medical professionals outside of our nurses.
So maybe it's someone from facilities potentially who could help us out about how we are intending to ensure staff and students stay safe when potentially we might not be able to identify immediate symptoms, you know, addressing potentially our cleaning processes and our temperature checks. Erica, are you able to take that one, or Dr. Crawford, is that one for you again, maybe?
I'm happy to start, and then if Dr. Crawford or Dr. Jackson want to jump in, that's fine. So I will tell you from the facilities and operations perspective, our number one goal is prevention of any outbreak. And so we will be, of course, heightening cleaning procedures, ensure that we have protocols for our staff and students, and making sure that the capacity of our buildings and our buses are maintained to a lower capacity so that we're able to provide that social distancing. And we think by abiding by all the CDC guidelines related to those things, we'll hopefully be able to contain any potential outbreak that could happen. Dr. Crawford or Dr. Jackson, if you have anything.
I'd be happy to jump in. Dr. Jackson, I know you're on the committee. I don't know if you want to comment first or.
Well, I just wanted to say, just echo what Erica said. We are definitely in that committee talking about the different guidelines, the recommendations, so that we can also make those recommendations. So our focus is really on the things that we know are working: wearing the face covering, social distancing, hand washing, those kinds of things, preventative measures.
And I would just add in that, you know, we know the prevention aspect from the PPE and the other things that we are looking, if we had a hybrid model and we were on site, that we would make sure that people complied with. I know it was mentioned temperature screening, and that was a question earlier. That's a discussion that's being had in the work group as well, from our school nurse perspective, as well as some of the outside medical providers like our consulting physician who serves. You know, that's just one measure. We understand that a temperature screening is one step. It doesn't cover everything. I think the suggestion was the question about loss of smell. That is, you know, are there other ways to get to potentially symptomatic people before they enter the building? And that is something that the smaller group is discussing, is a questionnaire. You may have seen that if you've been to the doctor's office or someplace soon. Do we do it in consultation with a temperature screening? The temperature screening has taken place over the summer and has been very systematic and successful. We know, of course, when we talk about a return to school, that situation is even larger. Just sheer volume of staff and students. Also, where do you take the temperature? Do you do it before the students get on the bus, or do you do it once they get to school? So lots of questions there. Dr. Hart is not on the call, but Erica covered most of that information of what the small group is working on, whether it's the screening tool that we use, if there's a way to continue the temperature checks, if that's recommended from the work group, but obviously the top being prevention. So you're raising questions.
Yeah, and I think in addition to some of those precautions that we are mentioning, that the team just mentioned, I think it's important for us to make sure that we have the feasibility of being able to offer like hand washing and, you know, soap dispensers. You know, we had a history of not having soap in some of our bathrooms. You know, I remember getting all the emails, right? And, you know, fortunately, I'm just putting it out there. I know you all are saying it out there. I listen to the staff members. I read all your emails that you all send me too. So I think that it's important for us to make sure that we have the appropriate soap in stock, which our team has been doing. I mean, in some ways, this global pandemic with having our buildings closed has been a blessing in disguise. And what I mean by that is we have been able to stock up on certain things like soap, because we haven't been using them from March until like in bulks like we used to. And we have been able to put in some new protocols around our cleaning. Miss Cordova, Anita Cordova, who's our director of custodial maintenance, she's been working with our maintenance crews and our custodial crews on ensuring that we have the appropriate soap dispensers in our schools, adding additional hand stations, for hand sanitizer, making sure that we're on purchasing additional PPE and having PPE in stock, meaning personal protective equipment for people who might not have it or who forgot their mask at home. I mean, think about kids who forget books and pencils, right? They're going to forget a mask if we get into a situation where we're back into some form of in-person instruction. So I just wanted to make that point in regards to these are what the CDC is requiring, but on our end, there are also things we have to do, like making sure we have soap dispensers working, making sure our sinks are working, making sure our hand dryers are working, all of those things that we knew were challenges prior to this global pandemic that we have been working through since March, believe it or not. So that's a good thing that we have been trying to be more proactive with that.
Yes, that's very valid. And we've had a live question come in from one of our bus drivers, and I know we have also transportation workers on our panel as well. So if you want to weigh in, please feel free to weigh in if you've got any issues or any concerns or any questions or input or feedback around the health and safety. This is your moment to please weigh in. So one of the questions that has come in live from our bus driver is, how can bus drivers be assured that students are going to be checked or temperature checked before they're going to get on a bus? How are we going to make sure that our buses are safe and it's not, our students are healthy and safe before they even walk into that school building? Maybe one for Erica, potentially.
So I know one thing, can I mention this really quickly, Erica? And I don't know if our new director of transportation is on this call, because I can't see everybody that's on it right now. But I do know that some of the discussions that we have been having around our buses, in particular with when should students be screened? And we had talked about, having protocols where families at home are screening before they get on the bus, and that we're practicing social distancing and face coverings on the buses, so that when the screening occurs at school, we've already set up an environment where we are meeting the social distancing guidelines, which also brings challenges, because meeting the social distancing guidelines, and I'm sorry, my son is talking in the background. I told him I was going to be on here live, but he's talked about Twizzlers, Mike and Ike's, and who knows what he's saying right now. But anyway, I feel what you all feel at home every day, people. Trust me. So one thing that I think is going to be important for us to do is to make sure that we are kind of working through these CDC guidelines for buses, and the implications that they bring is that when you're trying to adhere to face coverings and 6 feet apart on a bus, you're talking 9 to 12 people on a 77 passenger bus, right? Which changes our whole transportation kind of like operations. So these are some major implications that have an impact on, in-person and virtual. And this is why it's so important for us as these planning committees, these cross-functional planning committees, when we're meeting, to have the discussions around the implications and not just about the plan. I think that many school divisions have released a plan, but have all school divisions that release these plans, have they gone through a feasibility study on, yes, the plan sounds great, but can you actually do it, right? And we want to make sure that we're not putting something out there and saying, yep, ACPS, we're ready to roll. We're going to take everybody to come, and then we realize, oh, we can't do that because we have a transportation issue, or, oh, we can't do that because we have a staffing issue, or, oh, we can't do that because we don't have the funding, so we're making sure that while we're developing our decision for August 7th to present to the board, that we're looking at the pros, the cons, the implications, so that if something is not feasible, we can articulate that to our community and our staff members, in addition to keeping health and safety at the forefront.
May I ask a question? Sorry.
Absolutely, go ahead.
Has there been any reaching out to, for example, I have a friend who's in Hong Kong, and they're about 4 to 6 months in this wave of COVID ahead of us. And they were able to successfully open schools for about a month before they went on to vacation. And now they are, preparing to hopefully reopen as well. they're kind of, you know, in that part of the world, they're kind of ahead of us in these waves. Has there any been, you know, research or communication with schools that have successfully been able to reopen in some capacity on what has worked for them or not worked for them? I think it might be beneficial to see and research so that we can try and learn from their mistakes and successes as well. So just an idea.
Yeah. So Ms. Kessinger, I think that's a great question that you're asking. And Dr. Mozingo, she can actually elaborate on this, but we have someone who's actually working for us from the George Washington University. It's a doctoral student who is pulling all the research from around the world, because just as you mentioned, other countries are already open and there are many lessons that have been learned. Some of that literature has been posted on our ACPS at Home website. You'd have to know that to go look for it. But that's the information that our team is using to make some of our informed decisions and recommendations. But Dr. Mozingo, you may want to elaborate on some of the research that we have gathered, that our doctoral student, I don't know, is he a graduate, a postdoc student?
Yeah, hi everybody, hi. Yes, he has actually graduated from George Washington University. He works at the Naval Academy, works at the Naval Academy at Virginia Beach. And this is just what he does as a part of his interest in long-term research. So Dr. Hutchins is right. Initially, we had him to provide us reopening guidance from places all over the world, just lessons learned, best practices, things to do, not to do, different committees that should be set up. The other thing that he has done is he has also provided a lot of guidance and research actually around those places that open, closed, reopened, closed again. Early on, what he basically found was there must be a lot of communication. Second, he mentioned that you must involve a lot of people, right? Third, he found that when you develop whatever's developed, it must include aspects for staff as well as students as well as the community. We now have him researching nationally and internationally best instructional practices. So and the last aspect, the research that he will do is look at the components of our reopening plan and compare that with other reopening plans. So he's done extensive research, and we can make that available to everyone, but it really has guided our thinking and best practices around what is happening around the world. He does say that we can learn from them, especially in those places, South Korea, Israel, that open with large groups of kids and they've had to close, and some lessons learned about opening and closing. But we can provide that absolutely for you.
That is a great segue, actually, Dr. Mozingo. Thank you for that. We're going to now move on to addressing our delivery of learning and delivery of instruction. So we've got a lot of questions on that. If you have health and safety questions, you can keep them coming in and we will answer them and post them to the FAQ on the website. Every question that comes in today and throughout this week will get answered and posted to that FAQ. So please don't feel if you still have questions that have not been answered that we're not going to get to them. We will do. So if you'd like to now post your questions about learning and the delivery of instruction into the chat box, into the Q&A box, we can now get to some of those as well. So if students, this might be one for you, Dr. Mozingo again, but if students are required to learn from home, how will ACPS ensure students receive a quality education?
So thank you for that question. I'm going to also ask if Dr. Mann, who's also leading the work with the SEAL team along with Dr. Crawford, but Dr. Mann to actually maybe join me at the end of this one. I think first and foremost is that as the teams are developing the instructional schedules and the models, will have at the core of those models some best practices for engaging students. For example, I know just a simple example is that we may actually develop these with virtual field trips. So we know that we are going to have some more creative ways in which we engage students in a distance learning environment. I also wanted to comment in terms of this question is that we have some lessons learned from our summer program. Our summer learning program right now is a distance learning program. It's all online for our students. So we're actually learning a lot from that experience, and we'll be able to use some of those best practices as we go forward in developing models for the future. As I said earlier, we do have Heath, who is actually compiling for us some instructional best practices when you are in a distance learning environment. I don't know if Dr. Mann would like to add some of the thinking from the cross-functional teams this week in terms of quality education.
Thank you, Dr. Mozingo. One of the things that's come up in the cross-functional teams is setting division-wide expectations around feedback, also teacher expectations around planning, and then also homework. And so as we continue to think about the division level and then where's the flexibility for the schools, we learned in the spring the variability caused comparisons, and we want to make sure if we, in a hybrid model or all virtual, at some point students will always be learning something online. So we want to be consistent with those expectations. And then also our curriculum team are working hard on designing what our interface will look like with our technology services department, on making sure that also the curriculum is highly engaging visually with videos and other things as we use Canvas and other tools at our disposal as we move forward, to make sure that one, students are engaged, but also that we have effective instruction. And we're having Cora Kapelski and Dr. Kincaid go into our summer learning to see their lessons learned. What are some high quality things that are happening in our elementary program that is actually having live instruction that we can replicate and design professional learning for our teachers in August. And then the last piece is just, again, is making sure that we are thoughtful in how the professional learning is rolled out and how that aligns not only with our strategic plan, but our MTSS documents and also our teaching and learning framework, because we know good instruction, whether it's virtual or in person, there are some bedrock things that we want to make sure are articulated and everyone knows what those expectations are.
So thank you, Dr. Mann. And there's some questions coming around the resources that are being provided for elementary, particularly younger elementary students. And maybe you could kind of address some of those lessons learned from the spring and what we'll be doing this fall to help them continue to learn.
So I'll start.
I think
Oh, go ahead, Dr. Hutchins.
You go ahead. You go ahead.
Okay, I just wanted to say one of the things we will do at the elementary level in terms of our teachers, as we work with Dr. Hoover and her team, we will provide extensive training for elementary teachers on using Canvas, which is our learning management system. So we will use Canvas at the elementary level, and we will provide training on how to go through Clever, how to use the various educational apps, how to pre-record lessons and activities for students. So there will be a tremendous amount of support and training, particularly at the elementary level, in terms of using that instructional management system.
And
I was just going to add that professional. I was going to add that professional learning, I think, is key. And that's really what our staff need to hear and understand, is that none of us went to school to learn how to be virtual instructors. I mean, I'm just like, I didn't go to school to learn how to do all these Wii videos, and everybody thinks I love doing the videos, and I'm out of my comfort zone doing them. I love them now because it's part of my job now, but I didn't go to school to learn how to do all those things. So this could be a little intimidating to all of us, and it's going to be important that we provide the appropriate professional learning for our staff members so that you can feel empowered and confident in what you're delivering. And, you know, it can't just be like, you know, pick and choose what you want, you know, like it needs to really be focused on like, how do I engage kids virtually? You know, like what does that look like? Because it's going to be very different than when we're in class and in person and trying to engage, you know, our students. So we have to be very, very intentional about the professional learning opportunities we're going to be providing our staff members, and just, you know, adjusting with what that delivery looks like too, because the professional learning is going to be happening virtually as well, you know, in most cases, I'm sure. So I think that that is just the main point that I wanted to get out there, because I know staff members are like, but I don't know how to do X or Y. And it is going to be our responsibility as a school division to make sure that not only you have the professional learning, but that you also have the educational resources that you might need in order to deliver the instruction that we know our students deserve, especially if it's virtually, which could be different technology devices than we've had, or a different way of using certain equipment that you might not have at home that you might now need, that we may need to consider, you know, purchasing for the future. But these are all discussions that we're having right now, so that our staff, that you're taking care of, that you're feeling empowered, that you're able to do your jobs and serve our kids. And that's what we're all here to do.
And Dr. Hooper, is there anything else that you would like to add to that around technology and expansion of technology to the younger grade levels?
Sure, thank you. Yes, can you hear me, Helen? Okay, great. Sorry, so regardless of which model we use, whether it's going to be hybrid or 100% virtual, the technology needs for our student and staff really are the same. So we had a lot of learned lessons last year, but we will be expanding our Chromebooks down to 2nd grade. And then we will also be providing our students who are pre-K, kindergarten, and 1st grade all tablet devices so that they can access the curriculum. We're also, I mean, we learned that we need to provide more resources for our families and our students. We're working on developing some videos and some potential webinars for our families to roll out in August. And we know that the device is going to be needed for day 1 of school. So we are working again on the procedures of how we are going to distribute devices and internet access to our families in late August.
Thank you very much. So we're getting a lot of questions around 2 topics. One, substitute teachers, and secondly, the survey data. I'm going to ask Mr. Page to address the survey data as a summary of that, just a few minutes. First, I want to address substitute teachers. So how will substitute teachers be used if instruction is virtual?
So Dr. Wilkins, he can elaborate on this.
Thank you, Dr. Hutchins. I think what I'll say is that the process for requesting a substitute is still the same. The challenge, of course, is to find a substitute who can actually do this remote learning. So we're going to have to work with our departments, such as Department of Technology, Department of Teaching, Learning, and Leadership, to develop the content for what these substitutes are going to need to learn, and then have them take that training or instruction, and then make an assessment on whether or not they're able to provide, again, a satisfactory or adequate performance, you know, in a substitute role. So it's something that we're still studying and looking at, and we hope to be able to develop it more in the weeks ahead.
And, you know, I think this whole virtual learning piece has really forced us as a school division, and I think all public education, and really just educational institutions in general, not just public institutions, has really forced us to just reevaluate and re-envision what support, what substitute teaching, what teaching looks like. I mean, it has really changed a lot. And I think initially what we were trying to do in some ways, and not just here in ACPS, but I think across the country, was we were trying to replicate what we do in person. And I think we have to all accept the fact that we can't. We cannot replicate what happens in person. We can replicate some of the practices potentially, you know, but we cannot replicate in-person instruction. It's kind of like, I can't replicate being able to talk to you all in person. I'm so much better with you in person than online. You know, I just feel I need chemistry from people, in general. That's just how the being that I am, you know, and I'm sure there's some kids out there who are like me too, that being through a virtual communication it's just not the same for them. And that can have an impact on their learning. It can have an impact on your teaching. It can have an impact on what you're doing, whatever your role is within the school division. So I think we are going to have to use this moment as an opportunity to look at things very differently than they were prior to the global pandemic. And, you know, I don't know if things will ever go back to how they were. You know, I doubt it, honestly. I think everything for now moving forward is going to be different. What that different looks like, I just don't know, because we've been now exposed to so many other ways of doing things that it changes the game for us in a lot of ways. So it's an opportunity as well as, you know, a threat. I think it's a mix of both.
Could I follow up on that, Helen?
No, that was great. Thank you, Dr. Wilkins. So talking about learning environments, maybe our panelists, staff panelists would like to weigh in on teaching outdoors, being outdoors, maybe sort of moving our schools to an outdoor environment. We're getting some questions coming in around that. I don't know if you have opinions, thoughts, or ideas on that. Throwing it out to our panelists.
Hi, this is Sue Harita. If I can step in. The idea of teaching outdoors is not new. We have learning gardens at, I believe, all of the schools that we can utilize. We have spaces outside we can use. Of course, weather impacts. There would be rainy days or super hot days or super cold days where we would not be able to go out and do our learning outdoors. But we have options outside. We have been talking about those options on cross-functional committees. We've talked about different schools and the different layouts that they have, and every school has something different to offer. So it's hard to give a one-size-fits-all answer because all of our campuses are different, but it is an option. And I think kids would enjoy having class outside sometimes, and it would be a nice way to be safe and be face-to-face when weather permits.
I'd like to add some feedback.
Sorry.
Hi. I want to speak on the hybrid models. Teachers need to reinvent their classroom lessons to fit the new schedule while also creating new digital content, as well as separate lessons for special populations. What will ACPS do to safeguard planning time and lighten the instructional burden of a hybrid model?
You know, I think, and Dr. Mozingo can elaborate on this, but I think that some of the conversations that I've been able to observe with our planning teams about the hybrid model and like what would instruction look like is putting into consideration that we are going to have sacred planning time, because it's one, you're going to be delivering instruction in a very different way. So this is kind of like, this is new for everybody. You can't go to like a seasoned teacher and say, well, show me how to do it, because the seasoned teacher going to say, I don't know, you know? So we're all kind of like in this together, and we're going to need to make sure we have sacred time that is, you know, for planning for teachers. Many of the models in this area, and we've been looking at, you know, models in the Northern Virginia area as well as across, you know, the country, and a lot of hybrid models of people, you know, who've adopted the hybrid model, they've included like a day that is solely for planning for staff, one day out of the week. And it's a full day, and there is no type of instruction that's coming from a staff member to a student. Students might be engaged in, you know, asynchronous learning, but they're not actually with an instructor. And those are the types of models that we're also looking at. So what I can tell you is that planning time is sacred. It has to be, especially in moments like this, where it is going to require us to have to develop new lessons that sometimes, you know, we had that great lesson that we used to use every year that it's not going to work. I don't have my science kit. Yeah, I'm thinking when I was a science teacher, you don't have all your materials. So you got to come up with something new. That takes time and a lot of creativity, and we want to afford that time to our staff. But Dr. Mozingo, I don't know if you want to add on to that. I'm just sharing this because I was in a couple of meetings about this recently.
Yes, I'll be brief. I have, in looking at, gosh, hundreds of schedules, I'll be very honest with you, all over the nation, there are all types of schedules online. but there are some elements that are sacred, regardless of whether it's a hybrid or distance learning. There are elements that are non-negotiables that are sacred. Like he indicated, there's this notion of planning days. Systems have chosen different days as a planning day. What else is also sacred is that there is time within the schedules, just like before, but it would be through a Zoom, right? For team grade levels to meet, for teachers to have an opportunity for planning. So there are those non-negotiables in the schedules that would remain, but it would be in a distance learning environment, if that makes sense. Again, the planning days are established, but there's also dedicated time for grade levels or teams within these schedules to be able to still come together. And it would be in a Zoom type environment for planning, for reviewing new materials, for learning as a PLC. Some of those best practices will remain, but in the Zooming environment or distance learning environment. I don't think I've seen a schedule that doesn't include some type of planning.
And Dr. Mozingo, so are staff lunch breaks and duty-free lunch still going to be conducted? Are those also part of the non-negotiables? How are we operating in terms of adjusting our scheduling potentially as we go forward into the fall?
Thank you for asking that question. I think that's something that the teams are still examining and studying, and we're getting closer and closer. And so we will have some recommendations for those areas also. But I think that it is still different though, you know, like in this distance learning environment, but we'll have to think through that and make sure these schedules provide those different opportunities.
Yes, and one thing that we do know that even though we don't definitively have a response for this right now, one thing we do know is that we're not going to ask for staff members to work without eating or having some kind of break. You know, like that to me is just, that would be completely unacceptable. I wouldn't even approve something like that. So, and I don't think our team will even put forth anything like that. I would hope not. So I think it is important because I think that when we were talking about it was something that was going around. I can't remember if it was on a survey or something about eating in class. I think that was on a survey about eating in classrooms. And I think that triggered a lot of discussion like, well, hold on for a second. If the kids eating in the classroom, when am I going to get a break? When am I going to get to eat? You know, because I would have thought the same thing, you know, as a teacher. And it wasn't intended to assume that teachers would be in the classroom with the students eating. It was just the assumption that that how can we limit the traffic in our schools so that you don't have groups of kids walking down the hall going into one space, but not necessarily that now the teacher is also in a sense trapped for the whole day. You know, you can't leave your classroom. So I think that is a misunderstanding that I heard circulating a little bit out there. I just heard a few times. I didn't hear it a whole lot, but I heard some staff talking about, well, I'm not gonna be able to eat if that happens. So we definitely want to make sure that staff will have breaks and lunch and all the things that you just need. I mean, even now, like I said, even though we're home, we still got to eat, even though we're home. Like I tell my folks, you got to cut me off from 12 to 1. I need a break at 12 to 1. You know, now today I'm working, you know, doing between 12 and 1, but normally that is my break time so I can do what I want to do. And that is to sometimes work out or to eat. It just depends on what I want to do. But we all need our own sacred time each day.
So thank you. And I appreciate the mention of the survey again, because I'm actually going to turn this over to Clinton Page, our Chief Accountability and Research Officer. So we've got some questions that are coming in around the survey, and then I want to throw that open a little bit to our panelists to get their opinion on it as well. So firstly, Mr. Page, are the results of the teacher preference publicly available from the survey? And it was not clear what was being asked, and we were being asked about what our preferred option was, hybrid or virtual, or was it something different in the survey? Can you just help give us some clarification around those survey data?
Sure, absolutely. So thank you for the question. And I think first and foremost, I just need to start out with a huge thank you. We had tremendous responsiveness on the survey data. You all truly showed up as staff with over 2,000 responses. So thank you, and know that those data are so valuable in informing our planning. And also know that as we think about the survey data, we also know that that is a snapshot in time, right? So those data were collected the week of July 6th. based on your knowledge, based on what's going on around you, based on your lived experience and your context when you took that survey. Off the back of that survey experience, we also know that you are going to have new knowledge. You're going to have new experiences. There are going to be changes in context as the environment constantly changes around us. So know that we know that as we go through and are using it as a planning factor and are going to continue to engage and collect data across multiple modalities to ensure we're staying informed, such as this type of forum in terms of the concerns and questions from staff. So the survey data were presented to the 4.0 planning group last Wednesday, and then also to the school board on Friday. So they are publicly available. And we have a couple different bites in terms of the level of information you're interested in. So certainly we have a PowerPoint embedded within the board PowerPoint from last week under the 4.0 continuity of learning update. There are several slides that provide a high level overview of survey results. And then also in an attachment to the board materials is a 19-page, much more in-depth analysis of the survey results. And so we will certainly be continuing to message that out and actively push out those results to staff so that you all are not having to go hunting across electronic school board to find documents. But certainly if you're interested, they are there right now and publicly available.
And I just asked one of our team to actually drop those links into the Q&A for you, so you can find those links in the Q&A in a few minutes. And also there is a survey data web page on the ACPS at Home website where you can find the results of all three of the surveys that we've conducted so far. So thank you very much, Mr. Page, for that clarification. I just want to move on very quickly to our last topic. We are sort of fairly short on time. We have about 10 minutes left before we need to begin to close out. So one of the issues that came up, I know, or in the survey was around childcare. And what childcare opportunities will be offered, and what opportunities will be offered for parents who potentially are also teachers or staff members in ACPS who have children in other school divisions who might have different schedules. So what childcare options are there out there that we're aware of? And maybe our panel have some ideas about some of those too.
Well, we currently do have some work right now, some collaboration with like RPCAs, that's our Recreational and Park Services in Alexandria, with the Campagna Center. And there are childcare and camps and things that are available actually this summer. They started this summer to first responder families, and that includes, our staff, because I believe that our staff are first responders too in education. We're not in the medical field, but I mean, we're first responders. Many of our custodians and bus drivers and cafeteria workers, they've been working since March, and coming in to make our meal distribution possible and all those other things, which I want to give hats off to all of them for being in person in our facilities, even though we were working remotely. So we do have partnerships already that are available. We're having some deeper discussions around how do we expand that in the fall, depending on which model we have, whether it's a hybrid approach or a virtual approach. Some families still have to go to work. Some teachers, they still, especially if you're at home, or staff members, if you're working virtually, you still might need an option for your child because you're trying to do whatever your responsibilities are from home. That you might need some of those services. So we are having discussions with RPCA and Campagna. Dr. Mozingo or Dr. Crawford, I don't know if there's additional comments to that.
I don't have any additional comments. Maybe Dr. Crawford does, and I know that Dr. Hart is also working with a small team.
That's what I was going to add, exactly what you said, Dr. Hutchings, that Dr. Hart is leading the work with, I think, Mr. Huffman and our partnerships group with RPCA and Campagna and outlining supports that we can provide our family.
Yes, and I know that there is some childcare being provided already for ACPS essential workers. I know that we have some staff with children already in that childcare program. Where they're also following the ACPS summer school program, the virtual program, and helping support our students continue that while they're actually in that essential workers care program as well. So a real bit of collaboration between the city and schools, and I want to say hats off to the planning team for that, because that was truly commendable. So just moving on, I wanted to open it out to our panelists. I know that childcare is a hot topic, and I know that the logistics of childcare and looking after children and managing both your own family and also teaching and your own role in ACPS as a staff member is challenging. Can we hear from some of our panelists, our staff panelists, to see what you think on this?
I would like to address the question I've gotten from several teachers who work in or live in other districts and wanting to know if we have reached out to things outside of Alexandria, childcare opportunities outside of Alexandria, as it may not be feasible for our staff to use Alexandria Rec or Campagna. They may be looking at Fairfax County or Maryland or some other district that they have their children in DC or something. Have we looked at any of the childcare options for them?
So I know Dr. Hart is not on this call, but I don't know specifically if we've been communicating with child care services outside of the city of Alexandria. I know we have been communicating with a lot of our child care providers and partners within the city, but we will have to get back to you on that one. I'm not sure if we've looked outside of Alexandria, so I don't want to misquote that team and their work.
Dr. Hutchings, we have talked about it, just throwing ideas out there, and we continue to welcome input from our community on how we can solve this problem and support the child care concern that we know a lot of our staff members have. So we are constantly talking about that as part of our work in our cross-functional planning team meetings.
Thank you.
Thank you.
So another question. Oh, I apologize. Sorry.
No, go ahead, David.
So another question that I know that got brought up by a couple teachers in my sphere was people who have multiple students, multiple children. I know that there had been some discussion in the hybrid model about having students come in phases and groups and things like that. So has there been any discussion about making sure that if that is the choice, if that is the direction we choose to go, that siblings will be able to be paired together for coming into school, so parents will have an easier time of getting childcare?
So that I do know for sure that has been a topic of discussion with our planning team around trying to ensure that families, if there was a phase-in type approach, or if there were certain students who reported on certain days to school, that we would try to keep families together, so that and this is just hypothetical because we're looking at a number of scenarios, so I don't want anybody to walk away and say this is what we're doing, but like if students were to come on certain 2 days per week, that those 2 days per week, it's for the elementary, middle, and high school kid in their home, so that it's not 2 of your kids go on 2 days and your other child goes another 2 days, right? It just doesn't coincide with one another. So we are looking at things like that just to prevent some of those child care issues that could transpire if we didn't.
And Dr. Hutchings, if I could just jump in on that, the wording that we're using is household, since we know that sometimes it's not just siblings who are in the same house. So we are looking at households by address as opposed to just siblings.
Yes, thank you, Dr. Crawford. And I just want to remind our staff who are on the call that we do realize that this is a difficult situation for everybody. Many of us have our own families at home, and we're also trying to do our own jobs at the same time. It is a stressful time. It is unprecedented for all of us, and it is definitely stressful. And I do want to remind you that besides the individual health care provider services that we have, that staff also has access to the Employee Assistance Program, the EAP, for mental health assistance and any other assistance they may need as well. Through that program, they can access counseling, mental supports, and if you need supports on that, there's also access to stress management classes, work-life balance classes, social emotional health exercises, meditation, and also other additional supports as well. So really a great resource. I just want to remind our staff that we have that resource and that it is available to you at this time. We all appreciate that it is a very difficult time for all of us at this moment in time.
Yes. And in addition, I just want to, before we conclude, I know we have like 10 minutes, but I just want to reiterate, because there were a lot of questions around like the timing of our plan, and that, you know, we're not going fast enough. We're not getting information out, you know, soon enough. And I want to keep reiterating this to our community as well as to our staff. This is a very complicated situation for all of us. I mean, just think of right now, we've been talking for over an hour, and we can probably talk for 6 hours, honestly. We can keep going for questions and questions after question, because it's so complicated and so uncertain in a lot of areas that I think it would really be incompetent on our end to just push out a plan to quickly put something out there just to have out there, and not really have, you know, a methodical kind of like formatting and process where we're able to gather feedback and input prior to releasing anything. You know, this kind of discussion that we're having and the survey data from 2 weeks ago, and, you know, meeting with students on, you know, next Tuesday, and having our board update meetings and having opportunities to hear from, you know, different stakeholders throughout our community has been extremely beneficial. And it's going to allow us to have the best possible plan possible, you know, the best plan possible on August the 7th, when we make our recommendation to the board. If we were to just put together something with no input, which we could do, right? I could put together a plan, you know, I could just say, hey, this is what we're going to do. But I wouldn't, I believe that as a school division, we wouldn't have the appropriate input, and we wouldn't have the collaboration that for a time like this is just so needed. It's imperative. So I just want everybody to understand that this was all intentional in regards to our dates, you know, and we're staying true to our timeline, you know, even though the timeline to us is still aggressive. Everybody thinks August 7th is too late. It's very aggressive from the time we've been working on it since June. You know, this has been a work in progress for over a month right now. And it was just March when we all got pushed into this whole virtual world, and the guidelines that continue to change every week. We're getting updates on new questions and new data and new information that if we would have released something, you know, a month ago, it would be a totally different plan today as of right now. So I'm very, you know, grateful that we have taken our time with this.
So we just got one live question that's actually come in around that, Dr. Hutchins. So the question is, does ACPS actually have enough time to do the work to implement the plan if we are announcing a plan on August the 7th? And I'm going to make that our last question. If you'd like to address that one for us.
Yeah, so absolutely. I mean, the August 7th date is still a month before the students, you know, potentially start our school year. It's still a full month in advance. And along the way, we're trying to work through all of the implications, you know, the pros and the cons, the professional learning that will need to take place. You know, all of those things are still going to, you know, need to happen. And the advantage we do have is that staff have contracts that start on certain days. If we wanted everybody to come work right now, we can't. We couldn't get everybody to come do professional learning today because you all aren't contracted to come do professional learning right now, right? We can't assume that you have the time now to come and do what we want you to do, you know? So if we don't officially have even all of our staff until a week before school. You know, that's when we have everybody on board. It's a full week before school. So I believe that we have more than enough time to make sure that whichever plan we send to the board, that we will be prepared. And we also have to be prepared to make changes and to have flexibility, because we might get excited and we might say, this is the perfect plan for right now. And then September 8th comes along and something else, you know, comes along our way that we have to do some type of pivot or shift. We have to be prepared for that, you know, for that too. And I want us to keep reminding, you know, not just the staff, but also our community that we now know what uncertainty looks like. Before we used to know the definition of it. Now we got to truly experience this with a global pandemic. In January, no one could have imagined on March 13th, we would close our school buildings and that they still would be closed today, right? No one could have imagined that. So we have now been able to see with our own eyes and to experience what it is like to have to shut down our schools and not have control over tomorrow. And that's a tough pill to swallow. You know, I've drank enough water now that I've swallowed the pill and I've owned it, because the only way I'm going to be able, as, you know, the CEO, superintendent of the school division, to be able to foresee the future is by swallowing that pill and accepting the fact that I can't control tomorrow. Right. So I had to accept that so that I could be open-minded and think about how we move forward. This is going to be tough for everybody, but everybody's going to have to swallow this pill, right? To say, we don't have control of tomorrow, but we can be as prepared as we possibly can be. And that, you know, the best preparation is having the engagement and developing a plan, and allowing us the time to be able to do this, so we know the pros, the cons, the implications, and what is feasible or not moving forward. So I hope that answers the question. But I do want to say, because I know you're going to probably make some final remarks too, Ms. Lloyd, I do want to thank, you know, all of our panelists who are on this. I want to thank all of our staff members who took time out of your day to be able to tune into this very important information. We had almost 600 people engaged today, whether it was on this Zoom or on our live Facebook feed, and that is tremendous. It just shows the commitment that the staff have, even for staff members who are not on the clock right now, you know. So they're saying that this is important information. I just want to thank you all for that. We are so much better together than we are apart, and it is still an honor and privilege for me to be able to serve our community in spite of the global pandemic, right? In spite of all the thousands of emails that I get now that are so much, I used to think I got a lot of emails, but it's a lot more now. But in spite of all that, I am still very, very excited about our future. And I know that we have the right people. And I believe, and I say this to my college superintendent colleagues all the time, we are very fortunate to have the staff that we have. None of this will be possible without each and every one of you providing your feedback, your contributions, and even your frustrations. We grow through our frustrations. So I appreciate even when I get some of the frustrating emails, you know, from our staff members, because that allows us to see a different perspective and to put things into consideration. So finally, just thank you all for your candid feedback and for your participation, and just give us the grace, the patience, and the flexibility. And I know that we will be able to deliver.
So thank you, Dr. Hutchins, and thank you for being our host and co-moderator for today. We are almost out of time, but I just want to second what Dr. Hutchins said. This really has been a great opportunity to get to understand the issues we're facing a little bit deeper in the fall, to collaborate and maybe to try and begin to find some solutions for them. This is not an easy topic to discuss. It is definitely very complex. And is there anything else that our panelists want to add before we wrap up? I just want to say,
sorry. Sorry, I just wanted to ask you, you guys have been doing a great job. I keep hearing you talking about, you know, this hybrid model or the distance learning. I think a lot of the teachers that were reaching out to me were very nervous about even the hybrid model because of significant others at home who could potentially become ill and whatnot. I guess my question would simply be, what is the time frame for possibly sending out that next survey? Because I know hybrid can look very different. I know that there's some school districts that are doing 3 weeks on and then 3 weeks on for the next group of kids, and then there's other school districts that are doing 1 day off, 1 day on, 1 day off, 1 day on. Is there a plan to send out a more specific survey of what are you willing to do as a teacher? Because I know for me, one sort of hybrid plan is much more acceptable for my life with my 4-year-old at home and my husband traveling and things like that than another. So is there a plan to reach out to teachers and get more specific survey feedback on specific ideas that you have?
In addition to that, I would also, my apologies, Dr. Hutchings.
Oh, no, go ahead.
I was just going to say, I think the question kind of comes out of that is, what are specific supports going to be given to teachers to help with either a virtual or a hybrid plan? Because I know for certain one teacher that I know had to upgrade her internet in order to be able to handle the capacity of the Zooms and all the extra things that were going on. So I think just in addition to that question, I think another thing that needs to be thought about is what is the extra strain going to be asked for teachers to have, and what is going to be done to address that extra support that's going to be needed from a logistical sort of financial standpoint where it comes from there.
Yes.
Oh, thank
So,
you.
yeah, so to answer both of those questions for you, and I know we have like 1 minute left, and that is that we are working to make sure that by the end of next week, we have a sense of where we're trying to go. We're going to be working with our cross-functional planning teams. On August 3rd, we're planning to survey our families and our staff again, which is the following Monday. It sounds like it's far away, everybody, but it's really not. So we're going to be able to provide the staff, because you're going to have a better idea of where we're trying to land. At that point, it may not have all of the planning supports and everything that goes along with it until August 7th when we release, our full plan, but you will have a general idea of the direction we are trying to go to help you make an informed decision for you as well as for your family. And I just think it's important for everybody to know that the safety of our staff and our students is a top priority, and it will remain a top priority. We want to just make sure that when we release any plan, we're able to answer the questions why we're releasing this plan, and not say, here, we've released this plan and we have to get back to you on answers. We want to get through all of our answers now, and that takes time. That's why these discussions right now are so meaningful, because then we begin to, 2 weeks ago, I don't think I would be able to answer half of these questions that you all are asking right now. I know I wouldn't, honestly, but I feel more confident and comfortable, and our team has educated me enough that I can even respond, that I don't have to call on a lifeline every time, to answer some of the questions. So we're going to work through that. And in regards to David, tell me your question. Your final question.
Yeah, absolutely. So there was a situation where a teacher at the school that I work at had to upgrade her internet.
Oh yeah, resources.
Extra bandwidth and those types of things. So the question in relation to what Ms. Kessinger was saying is just, regardless of whatever plan we do end up choosing, whether it be a hybrid or a completely virtual model, there's going to be an increase in resources that teachers will need to have from an internet perspective, utilities perspective, and just wanting to get some information about how the district was planning address those concerns.
Yeah, so we will be able to have some more definitive information for you in the future, but yes, either model does require additional supports, and they're different depending on the supports that are going to be needed, and all those things have to be put into consideration. So we will be able to provide the staff with just a better understanding of what those supports are. And hearing some of the needs is what helps us with that. So I know Ms. Lloyd is telling me to stop, so I'm going to close my mouth.
Just a reminder.
Ms. Lloyd, can I add just one final thought? Teachers believe that the participation online will increase if we consider changing the grading policy that we have for virtual learning to, we had a 60% completion of assignment grading policy, and for the secondary students, we saw a decline in participation. So will you consider changing the grading policy, whether we do the hybrid model or we do virtual learning? That needs to be a consideration. Thank you.
So yeah, there's a full team for that. So we will have a full team that's working on all of our grading practices and expectations for staff, because that was one of our lessons learned with that whole grading policy, that also had an impact on the student engagement piece along the way, as well as learning loss in some cases. So we are working to refine those practices, and you're going to hear a lot more information about that soon. All right.
So I know we could keep going all day. We are a little bit out of time. I just want to say thank you so much for your questions. Thank you to our staff panel today for joining us. Thank you to our ACPS cross-functional planning team members who've also joined us today to help answer questions. If we didn't get to your question today, all questions will be answered in the FAQ and posted online under the reopening page on the ACPS at Home website. And we will be sharing that link in ACPS Insider next Wednesday, but please look out for it. I want to say a special thank you to Sue Horita and Dawn Lucas for helping us set this chat up today, because without them, this would not have happened. And then I want to say thank you to all of you for being on this call. Please stay connected, stay in touch, and thank you for your participation today, and have a great afternoon.
And thank you, Ms. Lloyd, for doing a wonderful job moderating this. So we appreciate your work too, and the entire communications team. Thank you all.
Thank you.
Bye.